A very good day to our lecturer. Today we are going to present the case study MIS Failure Analysis MICE etc. And allow me to introduce my team members. I'm Hong Ka and my matrix number is TR00002. And we have Liu Wenjing TR00037, Tan Chu TR00041, and Xiang Yifeng TR00066. And Xiang Yifeng is going to present the introduction of the case study.
MySejahtera is a national digital health platform launched by the Malaysian government through the Ministry of Health during the COVID-19 pandemic. It was originally developed as a key tool to manage public health risks, such as health screening, contact tracing, and vaccination registration. During the pandemic, MySejahtera was widely used in public places, workplaces, and healthcare facilities. In terms of industry scale, MySejahtera operates within the public sector and the government healthcare system and serves the entire Malaysian population with over 30 million users. It represents one of the largest digital health platforms in Malaysia. MySejahtera has also gradually developed into a long-term digital platform that supports public healthcare management and government health services. Moving on to the system overview. First, the main purpose of MySejahtera is public health management. It helps the government monitor health data, manage disease outbreaks, and support nationwide health initiatives. Second, it supports healthcare integration, and the platform connects individuals with healthcare services such as vaccination records, health status tracking, and access to medical information, creating a more integrated healthcare system. Third, MySejahtera also functions as a government communication tool. It allows the Ministry of Health to deliver official health updates, guidelines, and alerts directly to the public in a fast and efficient way. In terms of key stakeholders, the Ministry of Health is the primary authority responsible for managing the platform. The Malaysian government, at both federal and state levels, also plays a major role in policy implementation and decision making. Healthcare providers such as hospitals and clinics use the system to support public health operations. In addition, businesses and public premises are stakeholders as they previously relied on MySejahtera for check-ins and compliance with health regulations.
Alright, let's now move into the heart of the matters. What actually went wrong? So it is important to clarify that MySejahtera didn't suffer from a total technical crash where the app just stopped working. Instead, the real issue was management and governance failure. And next, we will move to the strategic MIS mismanagement. Think of it like this. So the engine of the app was running fine, but the driver, which is the management, didn't have a clear map. So there was a lot of confusion over who actually owned the collected data and a serious lack of transparency regarding how the system operates. And there wasn't have enough planning for what would happen to the system once the pandemic ended. And moving on, we will move to when and how it happened. The crack really started to show between 2021 and 2022, when everyone was using the app the most because everyone need to check in and also do vaccine updates, which is a mandatory, and the system was suddenly handling a massive amount of data. As this happened, people, including the politician in parliament, started asking, who is actually in control of this information? How long are you keeping it? Because there wasn't a clear plan for moving from an emergency response to a permanent system, and the whole government structures feel very shaky. And moving on to the symptoms of the failure. So, how did this look to the average user? we saw some pretty frustrating symptoms. First, there were data accuracy issues. Imagine you are trying to go to the grocery shop, but the app gives you an incorrect race status or show you have a duplicate profile. So this led to a lot of resistance and frustration because these errors directly affected people's daily life and their ability to enter public places. And on top of that, enforcement officers and businesses were often confused because the rules and the system weren't always clear or transparent. And moving on to the impact on the organizations. And what was the fallout of all this? It wasn't just a minor headache, but it is a real impact. First, reputation-wise, it really damaged public trust in government digital project if people don't trust the first big national health app. So it's going to be much harder to get them to use the next one. And the second, which is the operationally, because of the data issues, things like contract tracing became less effective. And lastly, socially and ethically, it created a lot of public anxiety because people started feeling like their sensitive personal health data wasn't being protected or they were being monitored without clear reasons. And now let's look at why this issue actually happened by breaking them down into three core pillars of management information system, which is people, process, and technology. First, let's talk about the people. The biggest issue here was a lack of transparency and accountability. Imagine you are using an app every single day, but no one can tell you exactly who owns your data and how it's being used. So this create a huge gap in trust. And on top of that, the people on the ground, like enforcement officer, weren't always properly trained, which lead to a lot of confusion when they try to help the public. And next, we have the process sides of things. Because My Sejahtera was rolled out so quickly during the emergency, which is the pandemic, the long-term plan got left behind. It's like building a house in a storm. You are so focused on the roof that you forget to plan to plumbing. So there were no clear exit strategy for after the pandemic. And the system didn't talk well with other government database, which is why we saw so many duplicate profiles. And finally, there's the technology. The main struggle here was weak data governance because the data was all stored in one central place. It raised serious security concerns. Users also had almost zero control over their own information. For example, if your risk status was wrong, it was incredibly difficult to fix it yourself within the app. And this will lead to the operational confusion as we mentioned earlier. And moving on, my team is gonna present the next slide.
Moving on to the ethical side of things, let's look at data privacy. Why is this such a big deal? Well, healthy data is some of the most sensitive information you can have. When people don't know who really owns their data or if it's being stored securely, it breaks the trust between the citizen and the government. Think of it like this: you are giving the app your personal health status every day, but the informed consent part, basically the fine print, was very blurry. To prevent this in the future, we really need clear rules on data ownership, and we must follow the Personal Data Protection Act to make sure data is not kept longer than necessary. Now let's talk about accountability. In any big system, when something goes wrong, someone needs to be responsible so it can be fixed. If there is no clear chain of command, it's easy for people to avoid responsibility when errors happen. This does not just affect the government, it affects every student, worker, and business owner rely on the app to get through their day. We can solve this by having a clear governance structure and using independent adults, kind of like a third party quality checkup to make sure everything is being handled fairly and legally. Finally, we have transparency. This is the bridge that builds public trust. As users, we have a right to understand why the system makes certain decisions, like why a risk status changes from low to high. Instead of leaving people in the dark, the management should use official public briefings and clear documentation. When you are honest about how the system works, people are much more likely to support it and use it correctly. It's all about moving from an emergency mid-seat to a professional, transparent standard.
Okay, for this part, I will talk about the purpose improvement and the key lessons learned from the message error case. So first, in terms of people improvements, one of the main problems was the lack of clear responsibility. Many users were confused about who actually controlled the system and the data. Therefore, a clear leader or authority should be assigned to managing message error, especially for data governance and decision making. At the same time, the government should improve communication with the public by clearly explaining how data is used and who is responsible. Public trust in the system can be rebuilt. In addition, proper training should be provided to enforcement officers and users to reduce mistake and misuse of the system. Next, for process improvements, strong data governance policies are needed. These policies should clearly define how data is collected, stored, accessed, and deleted. This helps ensure that personal data is handled responsibly. Change management is also important, especially when the system moves from emergency use to long-term use. Having a clear plan during such transition can reduce confusions and improve system effectiveness. Regular audits can also help monitor complaints and identify problems early. In terms of technology improvements, data security should be strengthened to protect the sensitive health information. Better system integration between government agencies can also improve data accuracy and reduce duplication. Moreover, users should be given more control over their personal data, such as being able to see how their data is used. This can increase transparency and user confidence in the system. So finally, there are several key lessons learned from the case. Emergency systems still require long-term planning, not just quick solutions. Transparency, accuracy, accountability are critical for public trust, especially in government information system. Most importantly, ethic considerations should be included from the beginning of any MS project. Okay, so this the last for the conclusion. MS failures are mainly caused by weak management and governance, not the technology alone. My suggestions lack of data transparency and accountability reduce public trust, and the data provenance and ethic issues hide, highlighted the governance GPS gaps. Alignment of people, process, and the technology is essential. Strong governance ensures sustainable and trust MS. Okay, so that's all for our presentation. Thank you.